close your eyes and smell deeply. And what do you smell, sir?
Cinnamon.
Wonderful. Close the other side and smell.
Cinnamon.
Wonderful. By doing this, we're showing that both nostrils are both patent because he's able to breathe in the scent. And also we're checking the olfactory nerve, which is cranial nerve number 1. The next area that we're going to be checking is the mouth. We're going to ask the patient to open up their mouth and say ah. Stick out your tongue. Here we're doing a number of things. By opening up the mouth, we're checking for the hypoglossal cranial nerve number 9. Cranial nerve number 12. And then by asking the patient to stick out their tongue, we're checking the facial nerve, which is cranial nerve number 7. And then we're also looking for any dryness. We're looking at the mucosa. We're looking at the rise and fall of the uvula. We're looking at all the mucosa in the teeth and the mouth as well, making sure that everything looks good and there's no unwanted, and that the tonsils are okay. You can visualize the tonsils this way as well. So you can close your mouth, sir. The next thing we're going to do is ask the client to sip some water. And this we're visualizing that he's able to swallow. The fact that he's able to swallow, we can then ask him to cough for us. And we're showing that he is, his gag reflex is intact. So we're moving on from there. Now that we've done the head, neck, nose, and mouth, we're going to move on to the musculoskeletal part of the exam. And we're going to start, you always want to start with the hands of the client. So while we're looking at the client's hands, we start with the fingers. We're always looking for any swelling at this point. If there was any edema, we're looking for the color, temperature of the skin, and all of such. So when we're talking about the fingers, we're talking about two different ways, a few different ways of actually having to test the musculoskeletal. So we can, the ROM of the fingers move in both adduction and abduction. Adduction is when you move your fingers apart, and adduction is when you move them together. So you ask the client to spread the fingers apart and abduct and then adduct and bring them forward. Then you're going to ask him to turn the hands supine, and you're going to ask him to, it's in a flexing stance right now, so you're going to ask him to, you're in an extending stance right now, so you're going to bring in your fingers inward, and that's going to be your flexion. So you can do it again, and that's one. You're going to do that bilaterally. So you're going to bring the fingers apart for abduction, and then you're going to bring them together for adduction, and then you're going to bring them inward towards you to flex and extend them for extension, and everything looks good. At this point, we would notice if there was any swelling, which would be causative from arthritis or anything like that, and his hand temperature and the look of everything looks great. With the wrist, we ask the client just to move the wrist in a circular motion. This is testing the wrist. If they were having any pain at this point, we would then go on to test him for any kind of carpal tunnel. And the way that we test for carpal tunnel is we ask them to put your hands like this and put pressure together. Do you feel any pain? No. If you don't feel any pain when you're doing this, carpal tunnel is not here. The next thing we're going to do is we're going to check for the bicep. We're looking for, in these areas, like any crepitus, any swelling or anything like that. The way you ask a client, the way we test this is to do a basic bicep curl. And we can do this at the same time bilaterally, so you could just bring your arms in for me and outward. It's a hinge joint and everything looks good. The next thing we're going to check is the shoulders. And we do this with rotator cuff test, and you can just put your arm in a circular motion. Good. If there's no pain felt at this time, then there's no need to proceed. Can you do that back on the other side, sir? Thank you. Wonderful. Okay, so that pretty much takes care of the upper body portion of the exam. So we're going to do the lower body, and for that I'm going to ask the gentleman to lay down. Okay, when you're testing the lower body, the ROM is really important. So you're going to first test that the patient can bring his foot up to your hand at a minimal height, very good, and then I need you to bring it out for me. Wonderful. This showing that the patient has very good run with this foot. We're going to go ahead and do it with this foot as well. Bring it up and bring it out, bring it in. Okay. Now, I can tell this he's not going to have any problems, so I'm going to ask him if he could bring both legs in, knees forward towards your chest. Perfect. And flex. Beautiful. Now when we're testing the actual feet, we're going to ask for him to bilaterally ballerina point. So point your toes. Perfect. And flex. Backwards. Great. Now we're going to check the strength of the lower extremity, and I do that by putting pressure on the foot, and then he's going to push back, and he has strong muscular. And then I'm going to do the same thing, put pressure again, and he's going to push back, and the same. I'm going to do the same thing with the hands. We're going to put pressure on the hand, pushing back, and the same. And this hand, perfect, and then ask him to squeeze my hands as hard as he can. Good. And it shows that he has good strength. Alright, so if you could stand up for me. The last part of this test that we're going to check is the spine. So if you can stand up. With the spine, we're going to ask you to turn to the back. And with this, we can say that he has a normal curvature of the back, which is a slight S curve down to the sacrum. We know that he doesn't have any kyphosis, any kind of hump, or any over-exaggerated S curvature, which would be signature with scoliosis, which is more prominent in women anyways. So we can see that the spine is well, he's not experiencing any pain visually. If we tell him to bend over for a little bit, we can visualize that he doesn't have any deviation in the spine here as well. You just ask him to take a walk, take a stroll for us, sir. And watching him walk back and forth, we can see that he doesn't favor any one side, that he has good gait. And for that, our assessment is now finished. Thank you.